Okay, students, today's topic is testicular examinations. Firstly, what is the structures and function of the testes? You can see over here the testes are two small oval-shaped organ which hangs below the penis in a pouch of skin called scrotum which produces sperm. This is a this is a testis below the penis. You can see this is a oval shape is called as a testis which produce the sperms. And its outer size is covered by the scrotums. This is called as scrotums. They provide the main source of the testosterone, the male sex hormone, which is responsible for the male sexual characteristics. At the time of the intercourse, this provides the sperm productions reach to the via mass difference reach to the penis and injections after the penis. So this is a productions done by the testis, and this is mainly done by the testis and main source of the providations testosterone provided by the testis. This is the male hormone which is responsible for the hair growth, which is responsible for the other sexual characteristics, honest of the voice and the other beards. This is mainly for the other sexual characteristics productions in the male due to testosterone provided by the testis. Testicular self-examinations mainly on the first look in the mirror at the testis get to know. Firstly, you have to go for the in front of the mirror and you have to look for the testis, its size, its shapes, its color, its symmetry, and get to the know. The size and shape of the each testis. Then you have to go for the individual testis and size and shape. The shape and size varies individual to individuals because of the age, because of your height, because of the weight, because of the skin integrity. The individuals, because of the color, individuals to individuals, shape and size and colors may be different. Varies from the persons to persons. What is the testicular self-examinations? Introduction. The testes, also called it the testes. Testicles are the male reproductive organs that produce sperm and the hormone testosterone. This is called as a testis. Main two functions in the male reproductive organs. They are located in the scrotum under the penis. The base perform either the shower or after a warm bath when the scrotal skin is relaxed and the warm. If you have to go for the testicular examinations, you have to go for the firstly shower and you have to take the warm bath. Because of that, your scrotum skin will be going to the relax and in the warms. So you can easily find out any changes in that. You can easily find out the skin changes. You can easily find out any mole, any tumors in the your testes. Hold the scrotum in the palms of your hands. Firstly, go for the bath and go. You have to go for the help of the mirror. You have to firstly take a scrotum skins in your palms and in your hands. Then examine the testicles at a time. At a time, you have to examine the testicles from upper sides and downward sides. Use the both hand to gently roll each testis with slight presses between your finger. Then you have to go for the gentle pressures of your testes. So you can easily find out any mass formations or any other deformities in the testes. Then place thumbs over the top of the testes and gently roll. So you have to look at the thumbs at top and sides and you have to gently roll the scrotums and the testes. So you can easily find out any changes. You have to go further looking for the hard lump in the front of the size and testis, side of the testis. You have to go for the hard lump. It means considered as a tumors. If you found hard lump, considered as a tumors. Then you have to go for the checking of the swellings and enlargement of the testis. you have to go for the swelling. If one or another test is different from each other, then you have to check for the redness, you have to check for the discharge, any swellings or enlargement of the particular testis. Then an increase in skin of a testicles. Increase in skin considered as a scrotum increase, or thickness of the scrotum can be increased in some swelling cases, in some epithelial cancer cases. So it may be chances of testicular cancer also, spreading of the testicular cancer also. So you have to go for the checking of the increased skin of the testis and the scrotum. Pain and discomfort at the testicles or the scrotums. At the time of the performing testicular examination, if the patients feel the pain and consider or discomfort, consider as something wrong in that testic, something's pricking sensation, something pain, like at the time of the gender pressing, so patients having the pains, or the it being considered as something irregular in their skins. Then unusual difference between one testicles and other. At the time of the feeling of the testes, at the time of the gender rolling of faces, you have to go for the unusual difference between one and testicles and other. You have to go for the checking of the any differences between both the testes. Or heavy feeling in the scrotum. At the time of the gender feeling, you have to go for the heavy feeling in the scrotum. If patients having feeling of heavy feeling, considered as a something is swelling in their scrotum. A dull ache in the lower stomach, groins, or the scrotum. Dull ache it considered as a minor pain at the time of the performing the testicular examinations, and the lower stomach, groins, or the scrotum in the at the time of the performing the testicular examination, patients feeling the dull ache, then consider raising patients having the some problem in their genital or reproductive organ or tract. Thank you everyone.